Hi everyone, Dr. Uman and I here again to answer some of your coronavirus questions. Dr. Moon, did you get any good questions today?
Yes, Dr. DiLiello. So we got a number of questions on Instagram. So maybe we'll jump right into that. One of the questions was, what happens if we test positive for coronavirus? So really great question. We got a number of phone calls and emails on that. So let's start like this. There's about a 97% chance that if you test positive, it's going to be mild disease. So that's great news. It'll be mild. You might have various symptoms that are similar to a flu. You might feel awful for a few days and then you will recover. Now, what goes along with that, now that you've established that you're positive for coronavirus disease, the key part is to keep you healthy and to keep your family and friends and loved ones safe as well and prevent them from turning positive. So I see this as two levels. If you're positive and very, very ill, you will receive guidance or you will present yourself to the emergency room. And there will be designated emergency rooms for that. At the moment, it would be the Jewish General Hospital. But like we said, there's a good chance, maybe over 97% chance it's going to be mild. And then we can talk a little bit about how you're strictly going to go home and protect yourself and your loved ones. So some of the things that you're going to stay home. There's no question about it. At this point, you cannot leave your home other than maybe going into the backyard alone because there's too much risk to yourself, family, and the public. You certainly don't want to have visitors in your home. You really don't want to have any contact with your own family. So one simple rule is maintain 3 to 6 feet. In our books, that might work out to about 2 arms lengths. So Dr. DiLiello, can we show what that distance might look like? So we're about 2 arms length away from each other. That's the minimum you want to keep between yourself and your family. You certainly want to be in a separate room if that's possible. You certainly want to have a separate bathroom if that's possible. You're constantly washing your hands. We like to think every half an hour. You want to open your window as much as you can. Yes, it's still cold, just to air out the house. It's not necessarily everyone's reflex when they're coughing or sneezing to grab a Kleenex, and if you don't have a Kleenex, to cough into their elbow. So if you're positive, you really need to be conscious about these things. There's no margin for error and spreading it to your friends and family. We've talked about this in the past. You're going to wash your hands before and after eating. You're certainly going to wash your hands after the bathroom. You want to keep the toilet seat down before you're flushing. Some basic things like that. Now, you're going to get a lot more information tomorrow. A blog is going to come out on all of the issues that we talked about before you're positive, after you're positive, some of the definitions between social distancing, social isolation, self-quarantine, what are all these things mean, and we're going to have a lot of practical tips, and it's going to be in writing, so everyone should have a look at that.
Great. So another question I got today was, how could I stay healthy when we're sort of forced to stay inside? So it's a really good question. I would try to stick to a routine. So set yourself a schedule, wake up time, have a healthy breakfast, set some time aside to do a bit of work. If you have to do homework with the kids, you could go outside, just still try to maintain that social distance to go for a walk. And we're gonna have a video come out soon where our athletic therapist, Rosemary, is gonna come up with some exercises that you could do just from the comfort of your own home. It's a lot of calisthenics, so push-ups, sit-ups, running up and down the stairs, things like that, just to stay active. But my best tip is really just to set yourself a schedule and stick to it.
Yeah, really important. We got at least 3 questions over the last week on this. This is from the Instagram again. What should I do if I feel anxious and panicked and hard to breathe sometimes? What an important question. And if we got a couple of questions here at Cardiogenix, I'm sure there's hundreds of people thinking about this in our audience. So this is the emotional side of the pandemic. As connected as we are in these times with social media and whatnot, it's easy to feel alone, and doctors and healthcare and public health is trying to tell you to be isolated. We are very social beings, so that's very difficult. So some of the basic tips we think is to decrease this onslaught of negative news that we have. Let's turn off the news. It's 24/7 bad news. We know what it's going to be. The numbers are going to be up. Let's just turn it off and do something that you like and watch a good movie. I think what Dr. DiLiello said is great. You need to get into a regular routine. The worst thing we could do is isolate ourselves at home, distance ourselves from our family, and then just be brooding alone in a corner with no routine. Let's try to keep our life as much routine as possible. At Cardiogenix, we always talk about the 6 pillars of health. So diet, exercise, stress management, sleep, social life, sometimes medication. So those are the 6 pillars that also not just physical health, but emotional health. And here, as you're socially isolating yourself, let's say, you want to keep the social life still up. Some kind of contact once a day with somebody you love in your network. Could be by cell phone, could be by email. Nobody knows how long it is, but please maintain that contact. And listen, we're always here for you. If somebody is experiencing a lot of distress, we can talk it out on the phone. And if that's not enough and things are safe for the patient and for the team, we'll have you come into Cardiogenix and we'll discuss that in person. For us, that's as important as being infected with coronavirus, because there's so many implications, mental health issues and emotional fallout from the virus.
Absolutely. Another question I have is, should I be canceling my doctor's appointments? And it's a really good question. So usually Dr. Uman and I, we always advocate for our patients to go to their doctor's appointments. These are exceptional times. So if it is for kind of routine follow-up, or if it's for an imaging test, say, just an x-ray to get, a baseline on your hands and osteoarthritis, things like that, it's recommended really that you postpone the appointment. And this is really twofold. One, to keep yourself safe and kind of in the comfort of your own home. And 2, also to alleviate some of the system, because definitely in the coming days, we expect to see more cases and it'll occupy some of the doctor's times. What we've done here at Cardiogenix is we've essentially rescheduled all of our non-essential visits to phone appointments. So if it's just to go over blood work and imaging, we could discuss that over the phone. And then, of course, if there's ever anything a little bit more urgent, you could call in and we'll see you.
Yeah, we don't want anyone to feel alone. We're here for you. You can call and we will answer that in some fashion.
Exactly.
I have an email question that we got. This is also a common one. I'm sure many people have this on their mind. My wife and I are in a vulnerable category and have been trying to self-isolate for several days now. So vulnerable might be anyone over 65, or it might be anyone under 65 with almost any chronic medical condition. After a week of no visitors and 3 days of no outside contact, so they've been really good, no trips to the pharmacy or supermarket, we continue to wash our hands throughout the day. My question is this: at what point can we relax on the hand washing if we have no outside contacts?
That's a great question.
Wow. Well, what a great question. Now, I really don't think there's any time when we should relax our guard. I mean, 3 days is a long time and it feels like 30 days, I'm sure. And one of our rules we have here is that, you just got to keep washing your hands often, maybe even every half an hour, because my fear is that, and our fear is that at some point we're going to let our guard down. The longer this social isolation goes on and the government and public health recommends that we stay inside, at some point we're going to break this link and break this chain of sterility. Somebody's going to pop into the house, we're going to go out, and if we're out of the routine of washing our hands, that's when we're going to fall ill. So
yeah, exactly. So the hands are really just the vehicle to bringing the bacteria and the virus in. And so just like you said, to make it a routine, and that way we just carry it forward. Coronavirus, no coronavirus, it's just a really good habit.
Absolutely. Like I guess we have not really changed our routine. We're always washing our hands, right, Dr. DiLiello here? from, all the years we've been practicing, and maybe we've stepped it up a bit, and I think it's a great practice for long life.
So I think that's all the questions that we had for today. So please feel free to send more questions in and we'd be happy to get to them. Stay safe, everyone.
Thank you.